This is my audience.
Okay. All right. I did my essay on the toll of mental health for nurses. Nursing is quite possibly one of the hardest jobs. You have to take into account for all the tasks a nurse performs throughout the day, such as providing treatments, vital signs, check-ins, observations, and simply just being there for the patients and their families. Usually if people are sick or in a lot of pain, they typically aren't the nicest or happiest and tend to take that anger out on the nurses or doctors. If you are considered going into nursing, you have to have tough skin. You can't let one little thing upset you or ruin your day. Consider each day a fresh start to helping someone recover. Now, when asking a nurse about their job, they don't always tell you the full story. They typically just say things like, "I love the feeling of taking care of my patients," or "the amazement of watching a patient recover is so breathtaking." But in reality, they are leaving so much more behind. What about the daily struggles that a nurse goes through? What aren't they telling us? Well, I'm going to tell you. Multiple studies show that nurses are being overworked and feeling burned out. In 2021, around 9,000 registered nurses were surveyed, and only about 40% say they were satisfied with their job. That means 3,600 were satisfied, and the other 5,400 were not satisfied. These nurses are losing the passion for their jobs. The short staff is hurting their ability to perform their daily tasks. Nurses are experiencing a great amount of burnout, depression, and anxiety throughout each day. They are working in a stressful environment daily. If you were to ask about 1,790 nurses if their mental health was poor, half of them would say yes. That's crazy to think that the job they love doing is causing them to be depressed and not wanting to work. Some nurses take their depression as far as substance abuse or even suicide. Female nurses are at double the risk to die by suicides compared to women in the general population. Some studies show that nurses are 70% more likely to die by suicide than most female physicians. Nursing organizations are being created, such as Emergency Nurses Associations, to help support the Dr. Lorna Breen Health Care Provider Protection Act. The bill helps to fund and prevent healthcare employee burnout and suicide. It also helps to strengthen mental health throughout all healthcare workers. If this bill is passed, nurses experiencing mental health conditions can have more support and backup for what they are going through. COVID-19 has impacted nurses so much that a lot of them are experiencing mental health challenges daily. They're in a lot of stress because of the short staff, and so many of them have to perform jobs throughout the day. Being overworked is causing nurses to gain more stress symptoms. Some aren't performing to their best abilities, and others have considered suicide. A survey shows that 1,119 healthcare workers were asked some questions. 93% are experiencing stress, 86% are experiencing anxiety, 77% are experiencing frustration, 76% are experiencing burnout, and 75% are experiencing feelings of overwhelmed. As a new healthcare initiative, they are trying to raise the awareness of mental health issues and the risk of suicide and substance abuse. After COVID-19, many healthcare workers started to experience a work overload and increasing anxiety. Nurses experience substance abuse by using many drugs to cope with their anxiety. This also explains some of the detrimental working conditions nurses face daily. Some nurses have even said it's gotten so bad they've had suicidal thoughts constantly. Nurses' mental health has not gone back to normal since its pre-COVID phase. Hoping these nurses reach out, some were asked on a scale of 1 to 10 about their mental health. Nurses rated their current mental health at a 5.8, compared to 7.8 before COVID-19, which is a decline of 26%. This is very upsetting to see that these nurses are going through this but aren't reaching out for help, because a lot of them feel like they need to help the others before themselves. With the organizations being created and spread, nurses will hopefully reach out and get the help they need. Some might not want to reach out because they look weak or stupid, but in reality, they are saving lives and we want to save theirs. Their work is truly not easy. It may look simple, but there is so much more to what goes on behind the scenes. So next time you're in a doctor's office or hospital, be sure to tell your nurses and doctors how much you appreciate their work, because it might make their day. Thank you.